You can start.
So, hello everyone, good evening. So, this is SARChI from Squad Medicine Research, and here we have Professor Nicolette with us. I'm sorry if I spelled it wrong, ma'am. So, Professor Nicolette is a professor, and she has a PhD in psychology, rated as an established researcher, and registered as a psychometrist. And she currently holds the position of a South African research chair in the development of human capabilities and social cohesion through the family in the Center for Interdisciplinary Studies of Children, Families, and Society in the Faculty of Community and Health Sciences, and at the University of Western Cape in South Africa. So she is the principal investigator for growing the niche area of early childhood development at the University of Western Cape. In 2015, she in 2015 she achieved the Chancellor's Outstanding Alumni Award in Health Sciences as well as the Dean's Research Excellent Merit Award in the Faculty of Community and Health Sciences. In 2018, she was awarded as the Academic Achievers Award for an established researcher in the Faculty of Community and Health Sciences. And in 2020, she was awarded the Best Established Researcher at UWC for 2019. Professor Roman's research focuses mostly on parent-child relationships, strengthening the capable families in order to reduce the transference of capability deprivation to the children and enhance social cohesion. She has published and presented her research both locally and internationally, with most recent edited international book title "A Closer Look at Parenting Styles and Practices," which even I want to read after studying the summary. And Professor Roman has grown the critical mass in family science in South Africa, as well as conceptualized and assisted the establishment of the Center for Interdisciplinary Studies of Children, Families, and Society in Faculty of Community and Health Sciences at UWC. She is a partner of 3 international research consortiums. These include an ECD International Research Consortium, UK, Brazil, Cuba, and South Africa, and a parenting research capacity strengthening consortium between 6 universities in Africa, strengthening capacity for research and policy engagement, and the development of an international research masters to address SDG 10 between South Africa, India, Malaysia, and Germany. Professor Roman is a strong proponent of academic development and academic mentoring. So, so that's about Professor Roman. Here we have got her with us, and we are indeed lucky to have her with us doing this. Thank you so much, ma'am. We are really lucky and excited to have you with us here today.
Thank you so much for the introduction and for the invitation to share my knowledge and skills in the area of systematic reviews. So it is very exciting for me to be representing my university and affording this meeting an opportunity to engage on this area of research. I'm going to switch off my video so that the streaming is better, and I'm going to share my presentation. Okay, so as you can see, the focus of today is to provide you with information on doing a systematic review. This is considered an introduction. So my suggestion is always that we listen to this process, we understand it from a theoretical position, and then we use our theory and we can apply it, because it's only in its application and in its implementation that we are able to understand how a systematic review works. I remember when I did my first one, I needed to actually engage with someone, and she is Professor Franz. We engaged together on a systematic review until I had experienced the process. So this is an introduction. It will have gaps because it is only through its application that we're able to do the gaps, fill the gaps. So let me move to the slide. So I can share these slides so that you also have the information with you. But what I've done is just to provide some resources, and believe me, there are many more. I mean, there are YouTube videos as well that can give you further insight as to conducting a systematic review. I always try to work in a developmental way, so trying to understand it from its very basics to its more complexities. So as you can see with my resources, just to add to the introduction, although I'm based within a health faculty, my positioning is from a social science perspective, because my interest is in the social aspects around an issue. So I've included, I've tried to balance the presentation. So there's some information on doing systematic reviews in educational research. You will find this information on health. And then, of course, just a general student's perspective of doing a systematic review, a student's guide. And this one specifically, the systematic reviews in educational research, it's a book that can be accessed for free at this link that I've also attached here. So when we talk about a systematic review, we're talking about an overview system of objects. I also like to move from a point of trying to understand the terms that are used. So for example, when we say systematic review, what does it actually mean? So in the two words, systematic and review. Systematic tells us there's a particular way that it's being done. There's a system, there's a particular process. And when we talk about systematic, we talk about something moving from point A to point B to point C. And we know then that when we don't follow the steps, we will get lost. So the first part of the two words tells us that we need to move in a particular way. When we're talking about review, review means that we're going over something that is already done. So that is just a basic way that I would like you to understand that when we talk about the systematic review, there is a particular process that we need to follow, and it is about work that has been done before by others. So I just have two pictures that gives you some insight of the holistic picture, which may be a little bit confusing at this point, but it becomes clearer as we unpack the process. So on your left-hand side, you will see that there is a funnel, and you will see that there's information that goes into this funnel, and at the end of it, what comes out is information of all the pieces that we've thrown into the funnel, and we get one holistic picture at the end. But in throwing that information into the funnel, you can see it's twirling around, and that means that there are processes to get it to be a holistic picture. So at the beginning, it's totally confusing. There's lots of information that we have to work through, but eventually, once we've worked through the information, it filters through the funnel, and at the end, you will see that single color, that single idea, that single solution to trying to understand the intention of what was being done. On your right-hand side, there is a more circular perspective of how a systematic review process starts and ends. So it will start with a question, and it moves through the process of being eligible. It goes through a particular method. There's particular criteria that is required. We go and collect all the information, we analyze the information, we interpret it, and eventually we write it up, which is similar to a research study that is done in primary research. So what is a systematic review? How do we understand it? A systematic review then is a means of identifying, evaluating, and interpreting all available research relevant to a particular research question or topic. So I'd like to rest at the first bullet, because the first bullet is quite important. So when we're talking about identifying, evaluating, and interpreting, there are 3 activities that happens in that first part. So the first part is that we need to go out and identify what is important to what it is that we are doing. Once we have done that, we then look at it and we say, okay, is this required? Is it not required? Is it important? Does it add value? So that is our process of evaluating. And then once we've done that process, we then look at it and we say, okay, so we've got all this information. What does it actually mean? What is it telling us? The next part of that bullet says all available research, relevant. Yes, you'll go through the information, but the important part of that is all available. Now, when we talk about all available, it means the information that you have access to. So I, for example, am at the university. And at the university, we are fortunate enough to have access to research literature, research that has been done before. And each university may have different, we call it databases, may have different databases that researchers have access to. And that's dependent on the funding of the university. If you do a search on Google Scholar, for example, there will be information that you can have access to and others that you can't. So that is why it is saying all available research. And in the third part, research question or topic, a particular research question or topic, not any question or not any topic, a particular research question. So what is important there is that you need to have a research question. But we will speak more about that as we move along. A systematic review is also considered secondary research. Why is it secondary research? Because the research has been done before. This is different in that there is also secondary research that gets done on databases. So primary research, where we go and we re-evaluate and we come up with a different set of answers. That is data. This secondary research is also data, but it's published or unpublished research. And just to make it easy for you to understand, articles. It could also be theses of students. If you look at the right-hand side of your screen, you will see that there is a pyramid with different designs, research designs. And as you move to the apex of the pyramid, you will find that systematic reviews are on top. So what that means is that systematic reviews are the highest level of evidence in terms of designs, in terms of research designs. Right at the bottom, you will have expert opinion. So as you move through, you will see that randomized control, it's even higher than randomized control trials. And as we move through this presentation, you will start seeing why it is considered the highest level of evidence. Systematic reviews are a type of literature review, but it has a particular system and process to it. So unlike other forms of review, where authors can include any articles they consider appropriate, a systematic review aims to remove the reviewer's biases as far as possible by following a clearly defined, transparent process. So what that means is that although it is a review of literature, there is a distinct difference. And the main difference is that with a literature review, you could go to Google Scholar, pop in some keywords, and it would give you literature to look at, to search through, and you will find some answers. But when somebody asks you, so how did you actually get to that particular answer? How did you decide to include those particular articles? Would you be able to answer those questions? I don't think so, though, because if you had done a systematic review, you would have need to go through a particular process in order to show that this is how you achieved the answer to the question that you posed. So a systematic review is also different to a narrative review. It's similar then in saying that with a narrative review, you could just tell a story. But with a systematic review, there's a structured method that is explicit in how it is being done. With a systematic review, the aim is always to reduce human error and bias. So all research has the potential to have human error and bias, and even more so in a systematic review. But in the systematic review, there is a particular process and there are components that ensure we will never eliminate bias and error, but we do try to reduce it to a large extent. So a systematic review is usually prepared by a team of at least 2 reviewers who have a thorough understanding of both the clinical area and review methodology. This serves to minimize, without altogether eliminating, human error and bias. So what it means is that I, for example, will do the review and I would have 1 or 2 reviewers with me who would ensure that I am following the process correctly, that what I have attained out of my search has been done through a particular process. We work with agreed search terms, inclusion criteria, and a search process. So what happens is that I have an extra set of eyes or more to ensure that I am following the process that is transparent and with reduced bias. So a systematic review through its process is then both transparent and well documented. I'm not going to read all the information on this slide, but what it basically shows us is the difference between a traditional literature review and a systematic review. So I will just select one, for example, the first one. In terms of the review question or topic. So within a traditional literature review, topics may be broad in scope. The goal of the review may be to place one's own research within the existing body of knowledge or to gather information that supports a particular viewpoint. In terms of a systematic review, it starts with a well-defined research question to be answered by the review. Reviews are conducted with the aim of finding all existing evidence in an unbiased, transparent, and reproducible way. So what it means is that when somebody looks at your review process, because you would need to write it up. So when somebody comes and they read what you have done, they would be able to understand and implement what you have done and then coming up with the same results. I'm going to use the second point as well, searching for studies. So in a traditional literature review, searches may be ad hoc. In other words, just random. You can go into Google, as I said, put in some keywords, and it will throw out some information for you about the keywords that you've indicated. And based on what the author is already familiar with. So you go in looking for particular research in line with what you potentially know. Or it could be that you also don't know and you're wanting just to find out. Searches are not exhaustive or fully comprehensive. However, in a systematic review, attempts are made to find all existing published and unpublished literature on the research question. The process is well documented and reported. Okay, so there is information on the differences between the two, on study selection, assessing the quality of included studies, and synthesis of existing research. So what are the reasons to do a systematic review? Well, we can summarize existing evidence about a particular topic. So, for example, if you are wanting to understand what strategies were used in order to manage, and because COVID-19 is a hot topic, I'm going to be using it as an example quite a bit. What strategies government used in order to ensure that harm was reduced during the COVID pandemic. That could be where you're wanting to find out information to come up with a particular solution. So yes, we summarize existing evidence. It could be that we want to identify any gaps in order to suggest areas for further research. And so when we go and we look at those strategies that government has put in place during the COVID pandemic, we ask the question, well, is there anything else that they could have done? Are there additional strategies? Maybe we must go do further research about it in order to understand what is happening. In order to provide a framework for positioning new research activities. And so when we find these answers and we see there are gaps, maybe we can then go and do primary research about that. We also do a systematic review when there is uncertainty about the effectiveness of interventions in practice. This is especially within the medical or health field, where we are trying to understand if the intervention that is used or proposed, if it has actually worked. So we'll go and we will look at thousands of published research about it and try to come up with solutions that will tell us if it has been effective. We do a systematic review when key questions remain unanswered, for example, about treatments, interventions, practices, or experiences. It is also to inform practice or policy with best available research evidence. And then, of course, to identify what is known or not known in an area to guide future research. So essentially, what it basically says to us is that we synthesize the information. We can use that information to see if something works. We can also use that we can also use that answer to see if there are gaps. And if there are gaps, we then need to do research in order to address those gaps. What are the advantages of a systematic review? Well, it's objective. Okay, let me start with the first one. It's a condensed approach to information. It condenses the information. So it allows the reader to access consolidated results of huge volumes of information. So, for example, if you have to perform a particular operation and you're not quite sure if that operation is going to work. So what it would mean then is to go and find a review. So you may not have a lot of time to read through the huge volumes of information, but maybe somebody has already done that. So you can then go and access that review to understand the information that you require about doing an operation, for example, or any other intervention. It is objective. So what we say is it reduces, does not eliminate the risk of bias and error when you are doing this research. I've indicated previously that you would have reviewers, co-reviewers with you through this process. And at every stage, you would go through it with somebody. It is balanced. It includes a broad range of studies which are identified via a thorough and systematic search strategy. So balanced in the sense of you can look at different designs. You can look at quantitative, qualitative, mixed. You could just focus on quantitative. And in that, you could look at cohort studies, cross-sectional studies, or you could just focus on randomized controlled trials. It all depends on what it is that you're wanting to know. It's verifiable. So because the review process is transparent, so there's transparency that is included in this process, it allows the reader to know exactly how the conclusions were reached. It's dynamic in identifying areas that are under research or identifying new research questions. So it provides us information on areas that may be very important, but there may not be enough information about it. And so what it does when we go through a review process, it means that we ask new questions. And then we have to do additional or new research in order to address that. It's replicable. Why? Because there is a particular methodological approach in how this is done. That will become clearer as I move through the presentation. It's readable because we try to write it in a very simple and easy way so that when somebody reads it, they are able to understand the process and apply it if they need to. This systematic review is also flexible because it can be updated on a regular basis. So, for example, if I do a systematic review now, I could update it in 5 years' time with the same process. So I could then say, okay, at the moment, I find that the interventions for COVID-19, those that were researched about the pandemic, may provide us with information now. And in 5 years' time, we may want to go back and see if there has been additional information that has been published about it. And if the position I took now has changed, if the solution is different, and if the answer I have is different than what I have now. This slide just gives you some information, and it says the same thing in all 3 components, but it's just telling us what you need in order to do a systematic review. So you will see there's a planning phase, there's a conducting phase or an implementation phase, and then there is a reporting phase. So even myself giving you information at this point, it's all part of the planning stage because we're wanting to understand what it is that we need to do and we need to prepare for it. So you will see that in the planning phase, we must find out what is the purpose of doing this. We then have to develop a protocol. So our protocol is also our proposal. It's a little proposal we have to do. And the proposal or protocol is important because that becomes your guide through the process. We then have to go and we implement. So we look at identifying relevant information that we're going to need. So we will go through the databases, go through the articles and retrieve the articles. We will select primary studies. Then we will appraise those studies to look at the quality. And out of that, we then will extract the information that we have, that we need, synthesize the information, and then write up the report. And this process gets validated with the reviewers, your co-reviewers or your co-researchers. So the broad steps in a systematic review starts with a clearly defined researchable question. All research, in my opinion, starts with a question. For example, in primary research, you will find, before you conduct the research, that you identified an area that is of interest to you. There's a gap that you need to understand, and in that gap, when you've identified an area of interest, you can't do the whole area of interest. The question is, what is it that you're really wanting to know? And out of that, you ask a question. What I would like to know is, do the strategies work that government has implemented? Now, the question I'm asking is in a primary research. So I'm just wanting to use that as an example to show you that all research, primary or systematic or review, starts with a question. Once we have a question, we will develop aims and objectives. We then move on to the plan, and the plan is the protocol or proposal. A plan is developed to ensure all available evidence on the topic can be located along with clear criteria identifying what will and will not be included. This protocol is often registered with a systematic review library, facilitating peer review and avoiding the need for others to spend time on the search. So what that basically says is that once you have the question, aim, and objectives, you then move into developing the plan. And in this plan, you will state clearly what you're going to need, what you're going to search, and then what you're going to do step by step. In most cases, protocols are registered. So registration can be with Cochrane, for example, but more and more people are also publishing their protocols. So for example, if you go through the Biomedical Central site, you will find that there are journals that are prepared to publish protocols of reviews. And that process is also a review process, so a peer review process. It won't just get published. Once you submit, it goes to people to look at, and they decide if this is of value. What is important is that that peer review also provides you insight as to how you can improve the intention of your study that you're wanting to do. And of course, the plus side is that it's published as an article. The next part after the plan is to do the search. The search is then refined and conducted before articles are screened for relevance, then assessed for quality and appropriateness. Once the list of included articles is finalized, key data are extracted and analyzed to produce a new perspective to the question based on the aggregated evidence. So what that basically says is, once you have the question, the aim and the objectives, you then will have keywords, search terms. You will then say, okay, what do I need to include? Why do I need to include them? And so it means that you will be screening in order to see if those articles are relevant to what you're wanting to do. Once you have them, you will then use a particular approach to assess if they are of quality and if they are appropriate for the study that you're wanting to do. Once you have all that information, you will sit and work through those articles and extract the information in a particular format that will answer the question that you have and address the aim and objectives. In that way, once the information is extracted, you will sit with the information and analyze it to the point that you are able to come up with an answer. Once you have that information, it is then written up and submitted, in most cases, for publication. I also have students who have done a systematic review for their master's thesis, and most of my PhDs include a review as an objective in the PhD studies because it is so highly publishable. But besides that, that is just secondary. A major important part is that why do we do new research when we haven't understood systematically, based on evidence and science, what is out there already in order to answer the questions that we have? So I'm going to start with phase 1. So in phase 1, we're talking about planning the systematic review. This is very important, and it forms the basis of doing the research. You have to start with this part of the review, plan it well, understand it well, so that it becomes easier for you as you move into the next phase of implementation. In this part of the planning, you will have many questions, but it's important to come up with one research question. So, the most important part of doing a systematic review, or any review for that matter, is a good, thorough, focused, specific research question. How do we formulate the question? Because it's not just any question. So, before undertaking a systematic review, you need to ensure that there's no other review that has been done about what it is that you're wanting to do. So you need to, for example, go on Google Scholar or any platform such as ResearchGate and go and find a review that has been done in your field. And I'm talking about a review that is exactly what you're wanting to do. Now, when I say this, some people will go and they will find reviews that are almost similar to what they do. Almost doesn't work, because almost leaves room for you to do a review that is slightly different to the one that you have in mind. If you can't find a review, then it means that you need to do a review in order to understand the literature in your field. Once this has been established, you then, in other words, establish that there isn't a review, you then move into creating the review protocol or proposal. In order to do that, you need to identify the study question that determines the focus of the review. The question should be clear and focused. So when we have a question, it could be that we want to assess the effect of an intervention. It could be that we want to assess the frequency of a condition. It could be that we want to determine the performance of a diagnostic test, identify causes and risk factors, identify whether a condition can be predicted, or assess the economic value of an intervention. So, for example, in the first one, we speak about where we assess the effect of an intervention. We're wanting to know if something works or not. So we formulate a particular question to do that. The same can be said about the frequency of a condition. So how frequently were people hospitalized during the COVID pandemic? What is the research saying about that? So we go look at what the research is saying. In the first one, we could say, what is the effect of government strategies during the COVID pandemic on human behavior? We can go look at the research that has been published on that. So there are different questions that we can ask, but already you can see there are very specific questions that we need to ask. And so in the teaching of systematic reviews, and you can go research on each of these in the literature on Google Scholar, and you will find that people have written about their process in just developing the research question. It's a good idea to go and research further on this, because I will only give you sufficient information to help you to understand and to see the process that people use. But it's important for you to have more information, more knowledge on how all of this works. So the most well-known is the PICO. Now, what happens in formulating a research question? There are particular things that you need to focus on. So, for example, the P. Now, in the PICO and PEO, in all of them, there are similarities yet differences, and each of them focuses on different methodology. So the PICO, for example, and the PEO, I use it in social science, but it's actually started in the medical health field. The Eclipse and the Spider are shift more towards qualitative research. So, and there's many other acronyms that are used in order to do this. So the PICO, in the PICO, the P is for the population, the I is for the intervention that is used. There's a C for comparison, which means that there may be a comparison of groups if there are more groups. And then, of course, the O is around the outcome that is formulated. The PEO has a similar intention. So it looks at the participant. It doesn't say intervention, but it means the same thing as the event. But importantly is the outcome. In the Eclipse, there's the expectation, client group, location, impact, professionals, and service. So there's a little bit more that is included in formulating the question. In the Spider, it's about the sample, which is similar to population and participant. Phenomenon of interest, which is similar to intervention and event. In this one, there is about the design that is used. The evaluation could be about the appraisal, and of course, the research type. So this is just an example for you to see how these acronyms are used. So in the PICO, for example, there is a question. In children with sickle cell disease, is long-term use of prophylactic penicillin absolutely necessary to prevent infections? So when you look at that question, the P is the patient. Who is the patient or the problem? It's sickle cell disease in children. If we look at the intervention, so what is being done? It's prophylactic penicillin that has been that is under study. There is no comparison with any other group, unless, of course, they had specifically stated in children and adolescents that could be considered a comparison. But in this case, there isn't a comparison. Our focus is only on children with sickle cell disease. And then, of course, what is the outcome? This is very important, which people tend to forget. The O is about preventing infections. So now they're looking at long term. So why, and that also answers why you need to do this particular study. And this particular study is to prevent infections. Someone could have had a different outcome. Someone could have said that it is to improve the health of children or the well-being of children. So this part for me is very, very important because it makes your study very focused. On your left-hand side, you will see the same thing about the PICO, but there is an S that is added at the end, the PICOS, which includes the study design. So this has been one of the critiques about using the PICO. I use the PICO all the time. because it's very comfortable. But there's been a critique that how do you know which design to include? So somebody has added the S as study design to show, is it a quantitative, or qualitative, or mixed study? So that is just an addition to the information. You will see that there are additional acronyms. So there's the PECO, which is about the population, environment, comparison, outcome. So it's similar to the, all of them are similar to the PICO, but people have just given a variation on it in order to include the nature of the studies that they are doing. There is also the SPICE, which includes a comparison and evaluation as well as the setting of where it is done. And then you've got the CHEMO, which is about the context, intervention, mechanisms, and outcome, which is often used within management and organization studies. So all of this is just information to add to the acronyms and trying to understand how they are used. So this one, for example, will give you insight as to what the Eclipse means, each of those letters in the acronym, and how it has been applied in the health field. So, for example, the E is for expectation. What does the research requester want the information for? And there's a question, what have you got on rehabilitation? So when they use the Eclipse, the expectation is, I'm looking to improve the discharge procedure from the hospital to the community where rehabilitation will continue. What have other people done? So as you can see, with the Eclipse, it is quite detailed in the planning, in the process of just thinking about what it is that will be done in a particular research area. So the types of questions that are asked about each of the letters tells us the extent to which the researcher has tried to formulate the question and how that could potentially be applied through the review process. This is an example of the spider. So how the spider is used, as I've indicated in the previous slide, but it gives us an idea of the approach to the planning in formulating the research question. And as you can see, I'm not going to read everything, but as you can see, for example, the S is for sample. So in this case, whatever the idea is, smaller groups of participants tend to be used in qualitative research than quantitative research. So this term was deemed more appropriate. So this is a justification for why someone would use a spider diagram. This process of formulating the research question can become quite complex. And so you can find what works for you, firstly. And secondly, the question should be the decision to use a particular acronym to formulate the question. Can you justify why you use that particular acronym? And the third thing would be that when you apply this acronym, this process of formulating the question, is it going to give you the specific question that you are wanting to do? So when we're talking about research questions, I just want to show you some examples of review questions. So for example, a service delivery question. An example would be, does delay in the referral of patients with low back pain by general practitioners affect stage of disease at presentation? That is a very specific question that is asked. When we look at it, we say, can we apply an acronym to that? Which one? Because already we can say patients, that is our P. What is the issue? The issue is patients with low back pain that are being referred. But when we look at it, we ask, so where is the O? Is there an outcome for this? Sometimes it could be that somebody specifically states the O. In this case, it's about affecting stage of disease, but that doesn't necessarily answer our outcomes. And we cannot assume, and so therefore we say you should ask a specific question that answers the participants, it answers the event, it tells us about the outcome that you want, and of course, if there is a comparison and what the study design is. In this case, one could also, so what is the intention of this? Is it to improve the referral process? Is it to help the patients? So this just gives us an idea of where the gaps could be if we have not applied the formulation of the question appropriately. It could be that we're wanting to understand person experience. So the question could be, what information and support should be offered to children and their families or carers during social distancing? The question is, why? What would the outcome be? Intervention study question. What are the significant changes in the parent-child relationship after the implementation of the Circle of Security parenting program? Now, in this case, in all of these examples, I've purposefully not added a clear outcome because it's important for you to see that this is a particularly important aspect of doing a review. You must have a clear intention of what it is that you're wanting to do and why you're wanting to do this. So that was around the intervention study question. And the next one is review questions on prognosis. For women in the antenatal and postnatal periods, what factors predict the development or recurrence of particular mental disorders? And in this one, it could be to ensure the well-being of women in those particular periods. So when we ask a particular question, in a sense, it automatically gives us an idea of the study types that we would need to access in order to address the intervention, the question. So for example, when we're interested to understand the interventions, it may mean that we must look at randomized controlled trials. We have to go and look at cohort studies. We may need to include case control studies. When we're talking about a diagnostic test performance, for example, it could mean that we have to look at cross-sectional studies. And these cross-sectional studies can give us information about how this test works. Some people could also look at longitudinal studies, which would also give us information about diagnostic test performance. So there are different types of questions that we ask. I've been saying that now quite a few times. Questions that are specific and intentional with a particular outcome. And when we do that, we then saying, okay, in order for us to do that, what are the studies that we're going to need to include in order to answer that? So in most cases, when I do a systematic review, it will be around including as a starting point all the big methodologies. So for example, I would include studies on quantitative, qualitative, and mixed. But when I look at the question and I notice that I am asking a question on interventions, it may mean that I do not include qualitative. So what I'm trying to show you at this point is how you grapple with yourself cognitively in this planning process of formulating the question. And I've spent quite a bit of time on this part of it because it is such an important component of doing a systematic review. Now, I'm not going to read any of this, but this is just to provide you some information of the various methodologies and designs that you will potentially look at in doing your review. Now, in research methodology, there are three big ones: quantitative, qualitative, and mixed. And each of them have different designs. And those designs then tell us the relevance of what was done and how it feeds into the question that you ask. Just remember, what is very important through this whole process is your justification for the choices that you have made. So when you decide to focus on interventions, why are you focusing on randomized controlled trials? So it is very important that you justify the choices that you make at every stage of doing a systematic review. This is just another example of the previous slide in a different format. So I wanted to get to this point. So after giving you information on how a specific question gets formulated, the next thing I wanted to just share with you is that once you have developed the research question, that will be your main question. You also need to have some sub-questions, because when we have a main question built into that question, we need to ask additional questions, and those questions filter into helping us unpacking that question. So I'm going to use an example and I will speak a little bit through that. So the review question can be framed in terms of population, interventions, comparisons, outcomes of studies that will be included in the review. So I've gone quite extensively through that in terms of the PICO, PICOS, SPIDER, Eclipse, and all of those acronyms. I'm going to give you an example that I've used here. The main research question: how is deliberate practice applied in health education settings? And how is it experienced by health profession students and educators? So those are two questions in one. So you could do one of those, or you could do the other. If you've got a big study, you could include both. The sub-questions to that. So I also like to start developmentally in research when you have a research question. So the first one would be, now these questions are just placed here. They're not in an order. But as you can see further on, it's about looking at the definition and descriptions. I'm just going to run through the questions. So what are the benefits of deliberate practice in health education? What are the benefits of deliberate practice in clinical skills? What are the perceptions of deliberate practice by health educators and students? How is deliberate practice defined and described by students and educators in health professions education? How is deliberate practice applied in learning and teaching in health professions education? So as you can see, the questions that are asked unpacks the first main question. Once I have the questions, I then shift to the aim and the objectives. Now, the aim is a direct link or transition of the main research question. And so the aim of the study is to explore the use and experience of deliberate practice in health professions education. The objectives are the steps that we need to understand in order to address the aim and in order to answer the sub-questions. So the sub-questions, the objectives are a direct translation from the sub-questions. And so you can see the objective is to determine and explore the benefits of deliberate practice in health education. So I'm not going to read all of this because you can see there's 5 objectives and there are 5 questions and they are linked. What I want to say though is that when we start understanding the data that we have, we would start with objective 4. So how do we define and describe deliberate practice? How is it applied? And then we will move on to the benefits and the perceptions of the educators and students. So this is just an example of how we formulate a question and how that question is then converted, questions are converted into aim and objectives. So when we are planning the review, it all depends on the purpose of the systematic review. There are many things that need to be considered early in the process of the planning. We have only done the question, aim, and objectives. Before starting, it's really important that you ensure the question has not already been effectively answered in a recent review and that no reviews on the topic are planned or already in progress. This is just a summarization of what I've said so far. A prospective systematic review may be referred to as a protocol or proposal, and that will clearly document the information about how to do the systematic review. It will indicate inclusion and exclusion criteria, which we will shift to, and the selection and reporting processes. Most importantly, there is a global or international guideline and checklist, which is called the PRISMA-P, when you are reporting about this. If you want to register the protocol, I indicated it can be that you register on Cohesion or Prospero. And there are processes in place to ensure that what you're wanting to do is feasible. There are also dedicated journals, such as systematic reviews in particularly the BMC Biomedical Central website. So that journal specifically publishes on systematic reviews. And I'm sure there are other examples that you could use as well. This is just an idea to give you the 17-item checklist. This is just examples. There is also an article that speaks to the PRISMA-P and how it is applied. So I would suggest that you read up on it to give you some more insight. This is how you are transparent. This is how you show how your study was done. And it indicates also how you have gone through each process around inclusion, eligibility, screening, and identifying what is required. This is the checklist. Once you work through the checklist, it will guide you through the scientific process of what is needed. There is also a link to that article for you to read. So now I'm going to speak to you about phase 2. Now, although I speak to you about conducting the systematic review, I'm not going to conduct it. I'm only going to give you information of what is required. But what is important is that you would address this in your planning phase first, before you go and you conduct the review. You need to plan very carefully because you need to indicate what you're going to include in your search and how you are going to search. So when we talk about searching, once you have developed a focus question and you have determined your inclusion and exclusion criteria, which I will speak about soon, you need to create an effective and efficient search process to retrieve all relevant evidence from a range of sources. So what this is starting to say to you that, right, we now have the question, we have set the aim and the objectives, we have a clear idea that there is no review that has been done about this. Now I'm ready to start creating the components of my review. And those components include inclusion and exclusion criteria. It includes search terms. It includes a process around how you're going to do this. What is important here is that searching is an iterative process. You will need to develop a search and continually review and refine it for constant improvement. So how we often do this when I work with my students is to say, let's formulate the question. Once we're happy with the question, let's do the inclusion and exclusion criteria. And then we will go and do a pilot. And so in the pilot, we actually go and physically conduct the study. We go check to see if our criteria and approach is working. Once we are happy with that, we then do the main study. So in our process of searching, we create a sample set. So the sample set would be the information that the process that we're going to need. We develop a search strategy. We identify relevant keywords and statements, which is our search terms. We combine and truncate keywords. So we start putting words together in order to develop our search. We test our search strategy, which is our pilot. We set filters or limits. We'll speak a bit more about that. We select the databases, and then we document the search results. So when we talk about the search criteria, systematic reviews represent an attempt to identify and analyze all possible studies that fall within the scope of the review question. Again, all possible studies, not everything. It may be studies that are available. Restricting a search to a general database, for example, such as Medline, so just using one database like Google Scholar, is not sufficient, because that is where bias can creep in. We're wanting to do it in a scientific way where we have done everything possible with the available resources that we have in order to answer the question. So when we do our search criteria, we should include the major databases. Now, I say major databases, but it could be that universities have different databases. But it's important to look at the ones that are most relevant, most important to your field. Reference of studies identified in databases, unpublished studies, which would include theses, for example. It could be that you also want to look at interviews that have been conducted with authors around data that is missing. And it could be that you speak a language other than English, so you could look at studies that are non-English. We then move to the inclusion criteria. Now, you would have searched for information, and now you have that information. So what I normally suggest is, when you do the search, ensure, so this is now once you're happy to do the search, when you do the search, ensure that you download the articles that are relevant. Now, in order to do the download, you would need to have inclusion criteria. And so at this point, that research acronym, the acronym you used to create your question becomes important, and you'll see why. So when we do the systematic review, there are two questions that we need to keep in mind in terms of inclusion criteria. The first one is the study relevant to the review's purpose? Should you include it? Why? Is it relevant? In which aspects is it relevant? Is the study acceptable for review? What makes it acceptable? Is it the design? Is it the methodology that is being used? Or is it the focus? Is that important for the outcome of what you intend to do? Systematic reviewers then formulate inclusion and exclusion criteria to answer these questions. So based on those two questions that are asked, the inclusion and exclusion criteria are then stated. It means then that the aspects of the PICO or the PICOS or the PEO or the SPIDER are then indicated and stated. Just give me a second. Are then stated in order to ensure that what is being included are relevant for the study. And so when you look at inclusion and exclusion criteria to be set, they typically belong to these categories. So the inclusion criteria needs to be based on study population. So remember when we spoke about the participant, when we spoke about the event, so that's the nature of the intervention. When we spoke about the O, which is the outcome variables. When we're speaking about the time period, now I'll explain about the time period, the cultural and linguistic range, and the methodological quality. So when we're talking about the inclusion criteria, we are saying that in terms of the time period, what is the time period that will be set for these studies that you are looking at? Are you going to look at it over the last 5 years, 10 years, 20 years? And if so, why? You always need to justify why you do that. If you say over the last 5 years, it could be that the review was done 5 years ago and you want to update the review. If you are saying 10 years, it could be that there's been a boost of research in this particular area and you're wanting to understand what it means, what has been found. It could be 20 years ago because there's not much research in the field that you're wanting to understand. My suggestion is always that you start without a time period in your pilot so that you can get a feel of the extent of the research that is in the field. The next one is on cultural and linguistic range. So the linguistic range I just touched on previously, that is about English. Well, there's quite a bit of literature on English globally. Is it that you are wanting to only focus on English, or are you blessed to have additional languages that you can check to see if there's been publications and if it could be added into your review? That could be your decision to make. And then we're talking about cultural. So cultural could be that you focus only on a specific country. It could be that you're wanting to look at a particular group of people and how they live and what they do. Again, it's about your choice. And then, of course, the methodological quality. Now, this you may not be able to do immediately because it's part of the systematic review process, but it's an important aspect to keep in mind. So when we're looking at the inclusion criteria, there are the 4 T's to keep in mind. The target group, so who will be in your study, the type of studies, what kind of studies will be included, is it quantitative or qualitative or mixed? What is the time period? So for example, like I explained the years, but when you look at the COVID pandemic, you would have seen that there are rapid reviews that are done because people needed to find answers very quickly on available research. So the time period, and if you look at COVID, it is just moving on to 2 years, 18 months to 2 years. And so the information is in a very short period of what is available. And then, of course, there's text selection. So which format of the text are you looking at? Are you looking at publications or are you including books and chapters? So those are the criteria that will guide you in selecting the articles. This is just something that you must also keep in mind because it plays an important part when you are developing your search terms. So when we are talking, and this is where the English and any other language becomes important because there are different ways that people state things. So for example, people may use a UK spelling in the way they write. So if I live in the US or I'm in a different country that uses the US English approach, I may miss those articles because it is spelled differently. So it's something that you need to keep in mind. When you're talking about abbreviations, what are those abbreviations? You need to write them out, for example. We talk about synonyms. So similar words. So when we're talking about COVID-19, some people will write on a pandemic. Some people will call it SARS. So it ensures that you do not miss out on important articles that need to be included. But if you have contact with a subject librarian, they will offer you good guidance in constructing your search and your search terms. So what are the steps when we are implementing the review? So you can see I have 6 steps. So remember, I'm speaking in conducting it, but this is also part of your planning phase. So I would need to apply inclusion and exclusion criteria to titles and abstracts. It means that you would have had to construct it in your protocol in order to do it. I will eliminate studies in step 2 that do not clearly meet one or more of my exclusion criteria. In step 3, I will retrieve the full text of the remaining studies. In step 4, I will evaluate the remaining studies for inclusion and exclusion. In step 5, I include studies that meet all inclusion criteria and no exclusion criteria. And by step 6, I exclude studies from systematic review with reasons. So it will be important for you to keep notes through your process, because in your process, you will also keep notes around why, so justifying why you choose something and why you do something. So why would you exclude studies from your review? So there are particular levels of a review to keep in mind. We call these processes and operational steps, and it's in line with the PRISMA framework. So a review takes place on 4 levels. There's the identification phase, where you search a title. There's a screening phase, where you look at the abstract, and you may need to also go into the full text of the article. But definitely the full text becomes relevant around eligibility, because in screening, you may also decide if that particular article is eligible to be included. So as you can see, although there are 4 levels where this is happening, they may either function independently or they would be happening simultaneously. And then, of course, in my mind, the one that stands out on its own will be summation, where the data is extracted and analyzed and written up or summarized. So in the identification, we use the keyword selection. So we identify a list of keywords and search terms that we would use in order to come up with the articles that are most relevant to what we're wanting to do. We would use different ways of applying these search terms. So some people will use wildcards, Boolean phrases. The important thing is that you have used all the potential search terms with their synonyms that is linked to the study that you're wanting to do. And you have implemented these searches through appropriate processes. There is the search strategy. So you identify the databases to ensure a comprehensive search is done. You will also need to access gray literature so that you can extend the search and motivate the decisions that you make to include the databases. So in terms of the gray literature, I've touched on it previously. Most of the gray literature would be in your master's or your thesis, that is research that has been done that you can access but often is not published. So that would need to be included. And so in the identification, there is the title search where we evaluate titles for suitability. So often the title may not be very clear if it needs to be included. And that's when we move to the abstract phase, which is also known as our screening phase. So this level uses the abstracts of the studies so that it can provide us with more information. It tells us about the methodology that is used. It tells us about the outcomes and whether we need to include that into our study. And now you can also see why the outcome is important, because it will help the study to be very specific. And you also need to indicate how you will record the outcomes. In this phase, it's around eligibility, where we obtain full articles. So now we will download the full text and place them into a folder. I normally name each folder according to a database so that I don't get confused with where these articles are coming from. So I would have a folder, for example, that is called Psych articles, and all the articles I downloaded from that database goes into that folder. Once I have these articles, I will then move into the next stage, which is around appraising the quality. And I'll speak a bit more about that. So we have a tool that is designed to ensure that we have studies that have methodological rigor. So what we do is, in a systematic review, we create a tool that has particular items or questions around the methodology. So if you are only doing one methodology like quantitative, you will have one tool. If you are doing quantitative, qualitative, and mixed, you would have a tool for each of the methodologies or designs that you are going to focus on in your systematic review. And so this appraisal tool will give you an overall quality score, which is then expressed as a percentage. And that tells us why you would include or exclude articles based on the quality. What are the aspects of the quality that is important to your study? You would need to indicate what your threshold is for including, and you would including a particular article in terms of quality, and motivate your decision. So in the summation, you will extract the information into, we normally use an Excel sheet. And in that Excel sheet, we extract and populate all the information of these articles. We then look at the information and we do a thematic analysis in order to understand what the cumulative information is telling us. And so we apply that analysis. People can use different analyses in order to get an answer. We choose to do the thematic analysis because it gives us depth in trying to understand the information and to answer the research question that we have. I now move into phase 3. Just a reminder again, we are still doing planning. So this is to give you an idea of where we're moving into in terms of implementation, but it's still important for your protocol. So phase 3 is the screening and quality assessment. So I've started speaking about it in the previous slide, but this gives us a bit more of information, and so it may seem a little bit repetitive, but hopefully it adds to some of the slides that have gone previously. So again, at this point, we're talking about screening. So record keeping is super important in this process. We love to use the Excel sheets. We use the Excel sheets for data collection. So remember, the articles are seen as data. So we create an Excel sheet just for our searching process. We also have an Excel sheet that records the quality scores of the appraisal process. We also have an Excel sheet that populates the information from the data extraction. So you will see we record the numbers of results for each database or source recorded before screening commences. So as we enter the database and we place our search terms into the database, we record that search term with the database. And at the first level, we record the hits. So how many articles did that database give us? The next step is to screen, and then we record how many articles we retrieve. So as I've indicated, we screen the title and the abstract. And so each reviewer will need to scan titles and abstracts to see if they match the criteria or have some value to the systematic review. This is done separately by each reviewer to ensure minimal bias, and results are then compared. In some instances, you may have one person doing this process and another reviewer coming afterwards and reviewing that person's process. But in order to reduce bias, it's always a good idea that you have two people doing it at the same time and then comparing the results. You then consult with each other to ensure how you get past the differences of that process. The next step is to then move into full text screening. So reviewers look through the full text of included articles to fine-tune the final collection of the articles that will contribute to the review. And so at this point, we look at the quality assessment. Quality of the articles are important because it tells us how that research was applied that you are reviewing. They may not have reported on everything, and because they do it that way, unfortunately, it means that they may not necessarily be included in the review process. This step usually involves two independent reviewers. The quality assessment considers the value of the studies under consideration and the eligibility for inclusion according to the criteria included in the review question. Again, you can see the question has come up. So the research question is very important throughout the systematic review because that is what guides the study. Usually studies are appraised for their methodological error, particularly to identify any possible sources of bias. There is a website you will see as we move through the process. There are websites that can provide you tools in order to do a critical appraisal. So when we talk about methodological quality assessment tools, these are rating scales that assess methodological quality and provide a means to critically appraise the literature. Scales are currently available to rate most kinds of studies, not all kinds of studies, most kinds of studies. Critical appraisal of the methodological quality of primary studies is an essential feature of systematic reviews. It is important, especially if you are working in highly challenging medical fields where you need to know that the approach that was used is valid. And so the methodological approach that was used, the question would be, how is the quality of what was done? Can we consider that to be a quality approach and therefore validate the responses that is given to answer the question that we have? So the quality assessment is very, very important. As each reviewer assesses the articles returned by the searchers, they must adhere to the inclusion and exclusion criteria that were defined in the protocol. A checklist or table will assist with this. No consensus exists on the ideal checklist and scale for assessing methodological quality. So there isn't a particular scale. So what people do is they will go to the CASP website, for example, and they will use the resources in order to create a tool, or they will adapt an existing tool in terms of methodological quality. Your table also serves as a documentation for each reviewer's rationale in selecting or rejecting articles. So record keeping, you can see, is very important because you need to share that with the reviewers and cross-check to see that what is being included, what is considered quality, is actually that, and that there's no bias involved. So full texts are then downloaded into folders. So this is just an example. It's a bit blurry, but it's just an example of the questions that are asked or what is looked at in terms of the aspects of quality. And you will see on the right-hand side, there is a grading that happens. It's different forms of grading. We don't use this grading. We have a different form. For me, it's very clear. If the article has it, they will get 1. If they do not have it, they will get 0. We cannot assume because we know that it is there. You have to work concretely with what you see. And so with what you see is what you assign a score. These are the checklists and the sites that I have spoken about, that I've referred you to. Within these sites, you will find that there are tools, questions, checklists that you can, resources that you can use in order to create your own, in order to create an assessment tool that you will apply to your study so that you can ensure that what you are including is considered quality, and you will then assign a score. So this is just to give you another example of how a tool looks. So there's the items, there's the scoring system, there are guidelines for how it is done. So these are resources which I'm hoping that you will access in order to create your own. These are additional links around a critical appraisal. You can see that on YouTube, there are quite a bit. There's quite a bit of information. But the site that is most used is the JBI and the CASP sites. They provide quite a bit of information on checklists and tools. So it's not like this information is hidden or this is something new that I am saying. The information is available for you to use and to create your own. Just remember, as with anything, you need to reference where you got them from. So the second last stage is around data extraction. So now we're extracting the data. So the tools used should be appropriate for the outcome of interest and identified and documented in the review protocol. The data collection tools are used to ensure all relevant data is collected, minimize the risk of transcription errors, allow accuracy of data to be checked, and serve as a record of the data collected. So without confusing you, in terms of applying this to research articles, it's about saying that I have an Excel sheet, I have these columns, and in these columns, I populate the information from each article that I consider to be relevant, that has gone through a quality check. And so I'm including that particular article, and now I need to extract that information. I, at this point, use my objectives as a guide for each column in order to populate the information in each of those objectives based on each and every article. So I would have read these articles more than 3 times in order to extract the information. That means I become well-versed with the data that I have. Remember, I said it's an iterative process. And so we will be working forward and backward through the process, through the articles, in order to answer the question. The data for the systematic review is the results from individual studies. So they are populated into the sheet. Each column is populated. The data is extracted before the analysis happens. Strategies to minimize risk of error when extracting data are to utilize a standardized data extraction form. So there's not readily ones that one could consider standardized, but it's often one that you create with your team, gets approval with your team, and is linked to your aim and your objectives. Often we do a pilot so that we can see if it works. So we use one article and we extract the information, and then we discuss with the team to see if that is what we are looking for. Through the process, we also consult with each other in order to establish. So remember, I said you need a content specialist and a methodology specialist. So some people just have an additional person who could be the content and methodological specialist, but you will often go to the content specialist to ensure that the information that you are extracting is relevant to what it is that you're doing. 2 reviewers to extract data from each study independently to ensure reliability and accuracy. And we do a blind extraction before conferring. So 2 people will do the data extraction. And when they do the data extraction, we will come back and we will talk about what was found, if there are similarities and differences. Again, I've given you some links about the data extraction. And the last part of the review is writing up of the findings. So you would have done a protocol, and the protocol would have all the requirements around the introduction, the problem statement, the rationale for what you're wanting to do, how you're going to implement the study in terms of methodology. And that protocol actually becomes the basis for your publication, because now you have to write up the results within that. So as you can see, the format. So your protocol would have all the information in. When you move to writing up in terms of an article, you will see that this outline I have indicated here is what is often included in the articles of a review. And if you have done this in your protocol, it is now that you actually have to verify that information and write it in the past tense as to how you did it. So what happens then is what gets added is a discussion part. So this is just a sort of repeat of another slide that I had, But ultimately, you would have a background introduction to the art in the article, and then you would have your process, you would have your results, and then you would have your discussion about the information that you have achieved. And that is the end of my presentation, and I thank you for listening.
Thank you so much, ma'am. Thank you. That was really an insightful presentation. I hope you can hear me. Yeah. And that's really everything that we needed to know about systematic reviews, I guess. That summed up everything, and even the formation of the question, the guidelines and all, I really found very insightful, man. That I was a lot confused about them while I was about.
Just give me a time. Just give me.
Okay, so I'm happy about that, and I'm hoping that it was quite simplistic.
Yes, ma'am.
And often it's about when we can apply it or implement it that it becomes easier to understand and do.
Yes, ma'am. Thank you so much, ma'am, for accepting our invitation. So, please let me know about the possibility of making a project. So we will call applications for project, and you can select. And since I think major our interest is child and family related, so we can pick a topic on that. Like you can suggest one topic on that. So then we can open calls and further discuss about the possibility of making it.
Okay. I think the best way to do it is if you send me an email specifically about it, what you have in mind. I can then respond to give you possibilities, and then we can start setting up a team. We can set up a team where we can move through the process of doing it, and then everybody can learn how it's done. And I mean, people can watch this recording in order to give them a basis of this. So that would be great. Are there any questions about this? I didn't have an opportunity to ask.
Yeah, I have a question, if I may, ma'am.
Yep.
I've heard that there are a few softwares, there are a few program things which will help us in classifying or elimination of articles and all. And I've heard a few apps like Zotero and all. Would you suggest using them, or is there anything that you use present?
Okay, I didn't hear the question. Are you asking about the software and programs?
I mean, I've heard that there are two apps which will help us in classifying our articles, like eliminated articles, and why we eliminated them in the Prisma elimination process using Prisma guidelines. So, in order to classify our elimination and the selection process, I've heard there are a few apps and softwares which will help us. So, I just wanted to know if you want to suggest any, or if you want to suggest using them or doing them manually.
Okay. So I always work from the concrete, so from the developmental perspective. So it's important that you first understand how the process works. And so that is this mechanical part that I've just done. So I've spoken through it, and I didn't give all the information because some information you actually have to go and do. So, but I like to teach that people first understand. Because remember, a software or a program is based on the manual part. So it's just making your life easier. But if you don't understand how the manual part works, then the software is actually not very helpful. Okay. So in terms of doing this, yes, some people, I've got students that use Mendeley in order to do it. But you would still need to do the search in the databases and move it into the Mendeley. So it works very well. I've done it. I've worked with Mendeley. So we can even have training on using that in systematic reviews. And then, of course, there are different softwares. There's Rayan. Rayan is a software that you can use to do a systematic review. There's another one it just misses my mind. But that is also a well-known one that you can use in order to do reviews. So yes, I don't like to encourage it if you haven't understood it. It does make your life so much easier. So it's got its stage where you can use it. But at this part of introducing something and seeing how it works, it's important to just understand it first at that level. So yes, to answer your question, I give a long story. But
Yes, yes. Thank you so much.
yeah.
Yeah, that's
Is
it, I
there any
guess,
other
ma'am.
questions?
Yes, ma'am. Like, can you comment on like the systemic Cochrane systematic review databases? How to assess it, or how beneficial it them, and when to start being a student?
Okay, I think I missed that one. I don't use Cochrane per se. I will use it in order to see if there is a review that is being done or that is registered with Cochrane. And you could explore it as a database, but because I'm at a university, I use the databases at my university, which provides me the necessary resources for me to access the big databases at the university. So you could use Cochrane, it has its place, and it will follow the same process as the databases in order to retrieve the articles, if there are articles published with them. Okay. I think
Tarun,
you're on mute.
you're on mute, Tarun.
Yes, ma'am. Like with this, the questions we are end with questions. I have created a group, ma'am, and I have added you. Like there are only limited people who are really allowing to answer the reviews. So we can decide any. I will add only genuine, interested people there. So once again, sincere thanks for your time. So I
I hope, okay. I think Tarun is having a little trouble with the signal, ma'am. I hope that's
Okay.
okay with you. Like, he was just saying that if he wanted to ask you about the thing, I will just email you about that, ma'am. I just listed.
Okay, so you can email me. I see
Yes,
there
sure.
is a WhatsApp group. If you have
Yes.
questions, that is fine. But the important thing here is that people will ask questions if they don't understand, and that is
Yes.
fine. But in order to reduce the lack of understanding and to make people more knowledgeable, it is often within the implementation